Let's have a conversation about. So we've been talking about this, the Merck Foundation, and we've been saying so. The Merck Foundation is an organization, and we'll get to understand more about it. And Ndu is not MAC,
No.
not Foundation from Merck. It is not the trucks. It is the Merck Foundation. Joining us in the studio to have this conversation is the CEO of Merck Foundation, Senator Dr. Rasha Kelej. She joins us in the studio. Good morning, Senator.
Good morning. Good morning.
So you are a senator in Egypt,
Yes.
serving for the next couple of years between 2015, 2020 and 2025.
Yes.
And you've also, you're a big person globally. So you've been named one of the 100 most influential Africans for 3 years in a row because of the work that you've done for very many things globally. But let's first introduce us to Senator.
Yeah.
Senator Rasha Kelej.
So now you want me to speak about me
Yes.
or the Merck Foundation?
About you first.
Or
Let's
the
start
senator?
about
All
you
of
first.
us? Okay.
Then we'll know this person who is in Merck. But
Yes.
let's know who the person is.
Okay. I am Egyptian, and of course means I'm African. I started with I cannot separate my life anymore from the work I'm doing. It became very work-life fusion.
Very
And
good.
maybe this is the secret, or maybe behind the success, or how I've been recognized in the ways you said. So when I speak about myself, I cannot distance myself from what I am doing.
Please don't distance it. Just continue.
So I started with Merck since 1996. And then in 2012, we started to do the foundation. The foundation is a philanthropic arm, which is non-profit organization, totally separate from Merck. It's owned by the owner of Merck, but it is managed totally by different team and independent team. And I am the CEO of the foundation. I established it from zero, of course, and now it's very successful. Proud that we have transformed the patient care in Africa in many ways. Like, for example, we trained the first oncologist in many countries. When I started in 2012, there was countries has no one single oncologist, for example, or fertility specialist, like Burundi, like Gambia, Sierra Leone, Liberia. What else? Zambia, also. I can't even what other countries? Sierra Leone, Liberia, Gambia, Burundi, Zimbabwe. Many countries that we went and we didn't find specialists. So I said to myself, let's start to build capacity. Transform the quality of healthcare, so we can create a platform of strong, skilled and trained healthcare providers. So we trained like 1,300 scholarships in specialties of 1 year and 2 year master degree from UK universities in underserved 32 different specialties: diabetes, cardiovascular, preventive, respiratory care, since Corona, acute care, intensive care, general surgery, oncology, reproductive sexual care, fertility specialist, embryologist, urology, dermatology, gastroenterology, name it. All of them.
1,300.
1,300 from 45 44 to 45 countries. They are increasing by the day because we always addressing new countries, mainly from Africa, but also some Asian countries like Sri Lanka, Nepal, Bangladesh, Cambodia, and also some Latin American countries lately, like Mexico and Colombia. But mainly the main countries, like 35 of them are 32 from Africa. So we were very proud to see this transformation. And every time we go to any country and meet our scholars and the people who graduated and see the difference they make when they see their patients, and they say that these patients will never be able to help or support if we did not have this training in this quality and this way. And each one of them, as soon as he finished the training and the graduation, they immediately, when they go back to their countries, they see at least 1,000 patients per month. So it's really satisfying, and we want to continue and continue and continue until we make a full transformation of patient care landscape.
That's really
In Africa.
impressive work.
Yeah, thank you.
Really impressive work, Senator. And when you say, you've gone into these 44 countries and found lack of specialties or specialists in the medical field in these areas, when they go back and they start seeing these very many patients, it means that there are patients who ordinarily would not have seen a specialist,
Yes.
who now have access to a specialist.
Yes.
What are the main reasons why these countries did not have these specialists?
It's lack of fund, a lot of stress and pressure on the health care sector. Sometimes there is no one interested to go further to have a study because they also overload with work. They are lack of number of graduated doctors, and mainly the financial resources. There is a lot of stress and pressure on the healthcare sector in general. A lot of diseases, a lot of vaccination here and there, and so I think it was needed to have collaboration with someone who has the vision. And it's not easy to implement it. It's not like I was thinking that when I start to say that there is scholarship offered, I will have list of people to me, and then we will have scientific committee to select who will select, because then, but it was not the case. It was actually, we have to push for the names, and we have to find more people who's interested. Not everyone was interested because it's hard work. And it's not going to be rewarded financially after they also graduate. So it was really tough. But we find also people who are passionate like us, and they want to make a difference, no matter what is the financial return.
Sure.
There was a lot of people like this.
So we see your participation, obviously health, well-being around the continent. Obviously, as you said, you cannot separate yourself, Ms. Anissa, from the work that you do. And looking at the work then that the Merck Foundation does on the continent, if we look specifically at Kenya, big partnerships with the Ministry of Health. Can you give us a little bit of an insight into that, with the kind of scholarships that are then been provided, and then what it then allows Kenyan medical professionals to then do?
Yes.
In country?
We had partnership with the Diabetes Study Group, the Cardiovascular Society, the Gynecology Society of Kenya, and the Fertility and Andrology Society. So there's this society, a respiratory society, so medical society. So these societies, we establish partnership with them. And then we tell them what is your needs, how many you want to train in this specialty, for example, diabetes, endocrinology, and cardiovascular preventive, in respiratory care, in fertility and sexual reproductive care. So they send us, of course, they make their own announcement, and they interview people and CVs and so on, and then they send us the list. We go through another screening, and then we will go for the eligibility criteria of each institution, and so on. So the doctors, after of course they receive the training, which is very difficult because it's 1 year and 2 year and online, and there is some clinical, but there is mainly online training with the University of UK, and they're still working at the same time, so it's very tough time management. But after they finish, all of them either establish the first clinic on their specialty in the area, because we don't only Nairobi, it's all across the country. Or they become important part with the Ministry of Health, for example, to establish new guidelines or new research, or data collection, patient collection. So they are actually contributing to many of the projects that it's needed, this specialty. And this for Kenya, for example, we've provided for Kenya specifically 118 scholarship, which is a very good number, and of course will increase year by year.
One of the things that I find particularly interesting and intriguing about the work you do is something that governments actually ought to do. What I'd like to understand is, what is the principle on which you base your partnership with governments so that you can actually provide this clear assistance that they need?
The main reason why we wanted to partner with each government is, especially in countries that is less regulated, like, for example, Burundi, Gambia, Sierra Leone. So it was very important that we want the help to go to the public sector. So the people, after they graduate, they go back to the public sector and they benefit the patients who cannot afford. And this was the main, to improve access to equitable and quality healthcare solutions. Therefore, the ministries of health or the governments or in case of Kenya, societies as well involved to choose the people who works in the public sector or academia, so they can actually also teach others after they finish. So this was the main thing. To ensure that they will come back and work also in the country, not just for example they get a good degree, they can work outside Africa. We want them to be inside the countries to help more people. Yeah.
One of the things that I've seen about one of my interactions with the work of the Merck Foundation is news articles and video content around this More Than a Mother campaign.
Yeah.
And this is about women talking about infertility and saying, let's destigmatize this whole issue of infertility. And I remember a video by former Taita Taveta woman rep Joyce Lay, who was also even talking about this even in Parliament at the point.
Yeah.
Tell us about this work that you've been doing. What's this More Than a Mother campaign?
It's actually very close to my heart, and this is a signature campaign of Merck Foundation, and we started in 2015 with the aim to break the stigma around infertility and around infertile women in specific, because when we started in 2014, 2015, there were many communities and many cultures only blame women for infertility, and they think that men cannot be infertile. And of course, based on that, you're laughing. Based on that, of course, they discriminate, mistreat women. I'm not only talking about husbands; they do that for their wives, but also mother-in-law, sister-in-law, and the whole community. So we wanted to first say that infertility is not a stigma or a taboo. It's a condition, can be prevented, can be treated, and infertility also can be prevented from early, because it's mainly due to it's a very high incidence in our countries, because it's mainly due to untreated infectious diseases, which is, if it is prevented, it's resulted due to child marriage, FGM, all these things that can cause infertility at a young age and can be prevented if we prevent all these things. And of course, men also 50% can be the cause of infertility. So men should support their wives, go to test it with them, and hold their hands until in the journey of making a happy family. We wanted to address this through ambassador of we have like 20 first ladies was ambassadors of the campaign, and they speak in social media for their communities about no to infertility stigma. Fertility is a shared responsibility. We have media recognition awards and media training, because in many countries we notice that media is reporting infertility in a scientifically it was not correct, and they were actually blaming the women, why she has to go and find someone to have for example children, things like that it is very much hurt women, and they don't understand that it can be the husband who is the reason of infertility.
Sure.
So on. So it was many initiatives, actually storybooks for children. Actually, we said, if you want to create a culture shift, it's not only for the people who is old now. It's actually, we have to start with the children. So the storybooks is about how to, emphasize the family values of love and respect between wife and husband. And the kids actually like the story, and they go to their community and their neighbors, and they talk about the stories to their mothers, and it made a change because they educate them. By the way, when you talk to people and they tell them that it's not only men, women, it's also men, they didn't know. There's too many people didn't know, genuinely. And when they know, they start to apologize and say, "Oh, we're sorry, we didn't know," and it was really a lack of information. So
When you talk about children, I'm sure Siti was just laughing and smiling,
why?
brimming, because he loves that kind of communication that starts.
That's at a young age.
I do.
Yeah.
Yeah.
I do. I have a background in education. So one of the things that I find close to my heart, if I may say so, is issues relating to young people, children. Yes.
Yes.
It always brings a smile to my face. Because whenever
Then you will
someone...
smile a lot with us because we have almost 7 stories.
You do?
Yes, for
When-
children.
So when you say smile, among the services you have, you also have dental services.
No. No. It's a good one.
I'm interested, just continuing to, your mother's more. Why did you pick first ladies? Why going with first ladies around different countries? What kind of influence do you think that they would have over anybody else?
They have their platforms, and it was very important for me that someone who has platforms and meetings with community on a regular basis to speak to them about this, because we want to spread the word. And it's not only first ladies, of course. There was also all kind of women leaders, and then we went to men leaders also, because we said it's not only have to be women,
Yes.
because men also can speak about it. We had a lot of men who can accept to talk about it, because also it was not every man at the beginning was enthusiastic. And but when we have the platform of the first ladies, also it encourage other women and other people to join the platform of ambassadorship and champion and talk about it in a different way. The whole thing is we wanted a bigger platform. Then after that, we collaborated with singers and artists and fashion designers and media icons that also they have their own platforms. It was only a start, and then we go through all the sectors. So even when we do one song, it's like a book of 1,000 words. A song with a message that everyone is following on social media and liking. It adds actually an important information than giving hard facts and data and do this, don't do this. It can be in a nice song or a film or something like this.
That's indeed very true. I want to play a clip here, which is talking about what you've just said. Starting this conversation from an early age, talking to children, and the books that the Merck Foundation has worked in publishing. And let's just watch this clip. It's also playing on our screens.
Okay.
Yep. So the books, as we see, then the books, just scrolling. This is storybooks that are playing,
Yeah.
and you can just also play
David's
this.
story,
what we're
Ride
seeing
into
here.
the Future, Rescue Jacqueline, Not You Who You Are, and Educating Linda. It's all about supporting girls' education and ending child marriage, breaking the stigma of fertility, which is David's story, and Not Who You Are, about stopping gender-based violence.
I see.
So it's all for children, and this is really my passion. Make the Right Choice. It was about coronavirus and a young man who has to stop working his daily job, and he has no money during corona lockdown, and a gangsters they try to persuade him to steal and rob things and stuff, and he said no. I have to be honest and loyal and so on, and then he got the help, and it's about choices and educating people how to make the right choices in life from young age, which is very important to shape the character of a child before.
How many languages is it translated into?
English, French, and Portuguese. So to go to all the countries of Africa. So yeah.
And so far, how many children have you reached with these books in terms of numbers?
We have in each country we have around 30,000 copy that distributed in each country of the countries I mentioned. But I rely also on online library and social media and our website and app. So because I know people also can, so we push it also on our social media, and we have on our social media 4 million followers, and I always, this is here also comes the rule of the first lady. The first lady also push it on their social media, her social media, and on the online platform of the Ministry of Education websites.
Do you allow your partner countries to sort of like reproduce more of this book so that the distribution can be wider?
Yeah. There's no copyright of this one.
There's no
It says
copyright.
no. As everyone can print it out and can use it, and also we change the name sometimes. For example, if some countries said these names are not really relevant, so we change the names of the characters according to
suit
to suit the country. Yeah, popular names.
It'd be really interesting to see or to hear the impacts that this has on a young boy or a young girl's life who is looking for, one of the, break the stigma, make the change and things like this. How because of reading such stories, then they can now see what decisions they can make for themselves in the future. Have you been able to see
Yes.
some of
I sat with a lot of groups, school groups and girls and students and so on in Namibia, in Ghana, in Burundi, in Guinea, Conakry, and I listened to them reading the story and the feedback they get from that. Like I said, when they go to their neighbors and aunties and speak about the story and how the feedback they get and the conversation they have with their families after that. And I, also these stories I always put it in our TV show. We have a TV show, our Africa TV show in KTN, and we put the links of all these social media and stories so people can also have access to it and read it. Not only children. It's really nice even for adults. The stories, lovely. And
Brilliant. Let's take a break at this point, 8:30. Kenya's biggest conversation. Our guest this morning, Senator Dr. Rasha Kelej. She is a senator in the Egyptian parliament. She is also the CEO of Merck Foundation. We are talking about the work that Merck Foundation has been doing across the African continent, supporting the health sector, supporting communities. And just now we were talking about the More Than a Mother campaign that she says is really, really close to your heart.
Yes.
And you speak so passionately about it.
This is the Situation Room.
And our guest, Senator Dr. Rasha Kelej. She is a senator in the Egyptian parliament. She is the CEO of Merck Foundation. That's what we're talking about. Merck Foundation that's been named the 2022 NGO of the Year. This is a big one. Senator herself has actually been named one of the 100 most influential Africans for 3 times in a row, 2019, 2020, 2021. And you've been telling us about the good work that you've been doing, also offering scholarships to upskill doctors in the African continent, in other parts of the world. 45 countries so far, 1,300 doctors have benefited from these scholarships, 118 of them Kenyan doctors, which is a big thing. Also, you've been supporting various awards. And this year, there's an award that you've introduced, the Diabetes and Hypertension Award this year. Tell us about the awards and why this particular one, diabetes and hypertension.
The awards is many categories. Is media recognition category, and song, best fashion design, and best film making award. And it's a theme. There's 2 themes. So it's in total 8 awards. One theme is More Than a Mother, is to address breaking the stigma of infertility and different topics of related to women and girls, like supporting girls' education, FGM, and so on. And the other one is about promoting healthy lifestyle, in specific raising awareness about diabetes and hypertension, because we know that it's very increasing dramatically, and I believe in the role of the media and art that can raise awareness about these sensitive topics and health issues. More than anything, more than having a leaflets here and there and distributed on people, media can have a creative ways. Songs can, for example, we have a nice song called Diabetes, No More Diabetes. And it's really lovely. And we did it in 3 languages, in English, the same one, same lyrics and everything, English, French, and Portuguese. And sang by 3 different singers, one from Mauritius for French, and one from Ghana for English, and a singer from Mozambique for the Portuguese. His name is Blaise. So these type of things, and of course also filmmaking. There's a lot of short movies, drama, documentary can also do the same, and so on. So from here I call for all the people who has talent to do songs and film or fashion design from Kenya and across Africa to apply for these awards.
So we're looking at the continent. Although Africa had amongst the lowest infections from COVID-19, the continent suffered heavily from it. And the foundation has been involved heavily in making sure that there's at least some bounce back across. Could you share some of that work that was done in terms of having people and communities, businesses bounce back from the effects of COVID-19?
I had 2 different strategies to support in Corona. One is the short-term strategy, and one is the long-term one, because I know that it's not only Corona; it's just things that will come afterwards as well. So was the bounce. We before Corona, we had all our training clinical, and we send them to, for example, Egypt to India and have clinical. So we started immediately the online training diplomas, and we searched for it across all the Europe and America to know which best courses that they can graduate from, and hence we launched all the online training diploma, 1 year and 2 year master degree in 32 specialties. And 2 important one was very related to Corona is respiratory care and intensive care, acute care, and critical care, which is very, very important. And I realized from my contacts that they were lacking of this specialty. So if someone had Corona, he cannot have a good care because there are very few people who is in respiratory care or in intensive care. So we've done this in a very wide scale. And the short-term strategy was a donation, because I don't believe very much in donation, to be honest. Donation also is needed as an emergency, but it should not constitute more than 10% of my work. The rest, it has to be about building capacity and helping people to help themselves and to be independent. Because donation only paralyzes someone. If you want to paralyze someone, give him something. But if you want to help him to continue and be strong, you have to educate him and give him the tool that he can do himself. The fish theory.
Right.
Don't give me fish, teach me how to fish, and so on. So I believe in this very, very, very much, because I believe in this for myself. I know that my education helped me to go places I will never be as an Egyptian woman from Middle East. Okay, and from Africa. If I don't have my education, I will never be there. So I know that this can take people to very good places.
As you're speaking and I'm thinking, it is amazing just how much an understanding and a belief in seeing something done can achieve. Because initially, remember, I mentioned that you're doing work that governments are supposed to do. And governments, it's the mandate of government to do these things. And you talk of building capacity. What else do you do to ensure that the work you have begun, the governments can pick up and take over, so that they themselves can do the very same thing that you are doing?
We do a lot of things with this regards, but of course for the people who is willing. There is some governments are willing more than the others, but we train the staff, we work with them, and we have always technical team meetings to tell them how we do it, what we do it. Even the whole contacts, what we are doing is with them if they want to use it at any point of time. The strategy and how we minimize is how we address everything in a very cost-effective way. even how to communicate in a very cost-effective way. Not only with the government, but also with all our partners, associates, people who contracts, vendors, even vendors who we pay them, for example, to do something. We teach them how to do it in a very cost-effective way, and in the way I learned. I have also 26 years experience in managing business, so I transfer this experience to them willingly, and because I know that if I do that, they will help me more and to achieve more and more in a shorter time and more cost effective. So yes, we transfer our knowledge to everyone, and we collaborate with them, and we make sure that they follow up with people after we give them the support and the help and so on. So it's there.
Do you work directly with training institutions like universities
Yes,
and colleges?
Definitely, yes.
Okay.
Definitely. On a regular basis, like weekly basis, because I do something they said we never done with us before. I have to follow up in each module what the students are doing, because if he didn't attend, I'm like a mother, If one he didn't attend, I call him. Why you didn't this week? You were not online. Where were you? And so it's like they called me Mama Africa for this, because I was just like, oh my God, okay, I will get your mother number, I will talk to her.
Right. So I mean, it's clearly a hands-on approach, and just
Yes.
Mama Africa, which you have been called, across the continent. This hands-on approach, then, have you seen that it has yielded results? Because you're there and you're saying, look, we can give you the training, we can give you the books, we can compose the songs and all of this, but something else,
Yes.
something more needs to be done to make sure that you remain on track.
Yes.
And actually do succeed.
Exactly. Being a mother. It's like a mother. Exactly. Like you do with your children. You just put them in school, but you make sure that they
Every
study,
day.
they graduate, why they did not graduate, what happened, why they fail in this, and so on. What did you eat? Did you not eat? All
Do you
these
have
things.
homework tonight?
Yes.
Have you done your homework?
Exactly. And this is not only me, of course, me and my team. We have an agreement that we have to have a meeting every week and see who is doing what, is not what. And of course, if despite all this and they fail one module, halas, I will not continue the scholarship.
Are you serious?
Definitely.
Wow.
So it's a 6
So
modules per year.
You take
They
up the
have to-
scholarship
yes.
knowing that I've got to go in here.
Because
100%
someone else will
committed.
take it seriously and benefit from it. We don't get good money goes after bad money.
That's very true.
This is very important.
How does the Merck Foundation fundraise?
We don't fundraise at all. It's just the fund comes from Merck every year, and I refuse totally to fundraise or to get. It's a lot of paperwork and a lot of hassle. I don't need to do. Because we want just to have this, and we manage it in the way that it is. We think it's correct, the way we think that it is, effective. Because we have vision. I have vision how to make it happen. And I don't want anyone to interfere in this, because I know it will be successful. I'm very autocratic in this one.
So what you're saying
Yes.
is that if you fundraise, then you will have other people coming with their ideas,
And
their
I will never be
agenda.
able to control the agenda. I have one agenda, is to transform and to make an impact, concrete impact with results, numbers. If I have anyone interfere, I don't know what is the agenda will be. I don't know. I can't control it.
Do you also work with
Could be
let's
having
say,
pictures and shake hands,
No.
Yes.
all over?
Yes.
Looking at the work that you do, all this work that you're doing, upskilling doctors, and also seeing how government can work to support this. How about at the policy level?
Yeah.
Do you work with legislators? Now you are a legislator. Do you work with other legislators to see how you can work on policy and laws in various countries?
Yes, this was the main reason. Also, we partners with first ladies, and to be able to see what types of regulation that is needed. There are some countries, for example, fertility care was not allowed; it's not legal. So we wanted to address that as well. But as soon as we had the momentum going, it just became like a domino effect. Everything was put in place. Even they were taking it forward and talking about it. And for example, the first public IVF center in Burundi has been established by the First Lady last month. And this was a very good initiative. It's the first public IVF center was established by Ethiopia, for example, last year, and the same in Burundi. And the same will happen in Uganda. So these all will help to have a public care for people who's infertility, which is people think it's a luxury. It's not a luxury at all because it has a social dimension. People will think we are overpopulated. Why we not know? It's person who has no child. He actually broken totally his soul and everything. So either we tell him it's okay to have no children. It's not taboo. It's not stigma. It's not everything. But also we can give you the support if you need. So this is very important.
One of the things that I say is important is how it is you ensure that there's continuity with what you're doing. Yes, you work with the governments, but it isn't as though the Merck Foundation is going to work with these governments forever and ever and ever. There's a point at which they'll say, folks, we've done enough, continue. What do you put in place to ensure that there is continuity?
These people are graduated. They are fire on, they are power. It's like kinetic energy. The people who graduate, they actually now, every one of them, you see big numbers. For example, in Mauritius, 63. In Kenya, 118. We still continue. These people, every one of them, I expect that they will be the future ministers, the future leaders. They are the one who is doing the first clinic here, the first specialty here, the first thing here. They're attracting international groups, international global fund. If you want to do, for example, a radiology center in a country, radiology center, like radiotherapy and all this, or cancer center.
Yes.
You first things, I have a fund, I want to do this, for example, as an organization. There's no oncologist, and you'll not do it. What are you going to open it for? If you have these people, they will be the one who's attracting the fund. They're attracting even the medication donation because they can dispense it and they can treat people and so on. So these people will continue. They are the one who will continue all the work. It's an army.
It is an army, but the system within which they will work. Eric asked the question, and I want to sort of like add on to it. Do you work to create platforms, systems, structures within which such a thing can actually function well? I mean, governments have their structures, but if they are coming in to help, it's clear the structures were inadequate. So do you help to foment, augment?
It is very inadequate. It's just the inadequate financial resources and different vision or different priorities. Of the government in some places, of course. And I can tell you that it can happen because we can all talk, but when we are in the position, there's a lot of things you will be under pressure to do that you cannot, for example, you say, do I treat these people who are going to die now, or I will train the doctors to help me after 10 years. So you have to have choices.
You're right.
That's why you always have to have the right partner to help you in filling the gaps of the things you cannot do right now. So everyone has his own priorities.
You put it well.
Something that you talked about when we talk about development, and you talk about now the impact, moving the impact of development on a people. And then you talked about the element of control, and if we can open that up just a little bit and say, then, if we're looking at impact, if we're looking at development, if we're looking at going into the future, then it's necessary to have an element of control, making sure that everything goes right in the beginning. If not, going forward, then you're almost guaranteed to fail. Do you agree with that?
Yeah, I agree with this very, very much. Not only on the level of the work, in the level of everything, even house, at your home, at your private life, there is a limit of monitoring, more than control. Monitoring and is a level of monitoring and then guiding. guiding is very important. We call it control. At the beginning, when you are in infancy stage, you have to control. It's like a mother when they are raising a baby. You raise a baby in infant stage, you are doing everything for him, and then he get a little bit independent. You teach him things to do, little things, and then more and more and more until you give him all the tools that he can be totally independent. For organization, the same for the programs as well.
You said among the things that you do is once you have identified a beneficiary for one of your scholarships, you and the foundation will be very, very keen to see that they are actually benefiting from this. Once they go back to their country, what do you do to follow up?
A lot. A lot, of course. We actually, first of all, they are alumni. All of them. So we are always in the groups. We always have annual summits and meetings, and we have WhatsApp groups with them, and we follow with videos and sharing their stories in our websites and social media, success stories. If they have any challenge, if they have any things you need to update in their skills as well in the future, they still will be with us. And whoever we trained by us and have a scholarship, they always continue with us because medical field is always have things to upgrade and to renew. So it's not ending there. It's always with us as much as we can, of course, afford.
Do you support them in establishing? So, for example, like you said, you have gone and trained an oncologist and they've come back to their country. One of the reasons why this country did not have oncologists is because, well, of very many things, like you said, lack of political goodwill, lack of capacity, lack of financial ability to set up. Once an oncologist has come back to a country that had zero oncologists and therefore zero cancer treatment centers and cancer care centers, what do you do to help them start off to see their patients?
How I will help them to start off?
Setting up a clinic.
No, I mean, look.
Or have you gotten a government commitment that once we train these doctors
once
and they
they
come
are
back?
being recommended by the government has a plan that when they come back, they will have to have for them a clinic or so on. Otherwise, we will not send them for start. So it's always complemented by a plan of the government. And of course, there is a lot of things can be done, like chemotherapy, like surgical oncology, that it doesn't need, for example, radiology center or high equipment and so on. So there is a lot of things that it's basic. It was not even done that it can be done for cancer at the beginning. And then as soon as they are a good number, they start to do because they have fund. They have fund to do cancer, for example, center or so on, but they need to know where to start. And by the way, we might talk about it casually this way, but oncology training is very difficult to find. You cannot send an oncologist because to have an oncologist you have to have a specialty first. This is if you have in a country, for example, you want to have pediatric oncology. Okay, the country has only one pediatrician. So send him to training, we will have no pediatrician. So it was very difficult to even allocate people to go for the training. I understand the difficulty, but we organized it in a way that it was really effective. And as soon as this happened, it will be easy for them to do the cancer center. Very easy, because this was the main challenge. Human resources.
Human resource. So I'm hearing you say also, and maybe you can just either clarify or say, it is absolutely necessary with the way that we have governments having been established right now and the way in which we work. It's absolutely necessary to have help from outside.
Yes, it's a multi-sectoral approach. It's a very high burden that one organization can handle. It has to be a multi-sectoral approach. It has to be international, global collaboration in many ways. Everyone comes with his expertise to help and organize, but under the umbrella of the local authorities and local partners.
I'm sure you know that Kenya is rolling out the universal health coverage.
Yes.
It's a big program in the country. The president has talked about it, leading from the front, conversations happening all over. Diabetes and hypertension This basically starts off at that primary health level. And there's a lot that needs to be had in terms of information, creating awareness, and in terms of screening. What do you think for a government like Kenya or a country like Kenya needs to do to increase awareness and screening for diabetes and hypertension?
As they're doing well, and you understand they're collaborating with groups. The groups I met yesterday was the the diabetes study group and the cardiology group society. They are doing great things, and I think the best thing is to collaborate, and they are collaborating with the Ministry of Health. Look, the burden is so high. It's a very high population. It's a very wide country. It's very difficult. It's very difficult. You know, there's countries are too small, it's 1 million population, and very small and still too hard. So it is, I mean, actually, I think that us, like media and art and groups and doctors, it's not only, it has to be multi-sectoral. It has to be even part of the education of schools. I think this could be a good idea also as part of the education of the children in schools, that how to prevent diabetes, how to early diagnose it, and so on, and hypertension and so on. So this one thing, education through the media and programs and awards, and like we are doing, through artists and songs, even to be part of films and movies and episodes and soaps and so on. So I think it will.
Indeed.
Yes.
We thank you very much for joining us today. Senator Dr. Rasha Kelej is the CEO of the Merck Foundation, also a senator in the Egyptian Senate, serving between 2020 up to 2025. So you get a nomination among the people who were nominated by the president to sit in the Senate. Can it be renewed after 2025?
I'm not sure, but of course I hope. It was a great honor and a pleasure to be part of this, and we've done a lot of nice things, defining a lot of policies to human rights and women rights, children rights, elderly rights. So I was really part of this. I was very proud of that, and I hope I will continue after 25.
Keep doing the good work that you're doing, Senator.
But can I say one thing before
Yes.
I go?
Yes.
Do you know that we have a TV show in KTN? Our Africa TV show. It's aired when? On Saturday or what? I think. Yes. Saturdays.
Yes.
So this is very important, because this is the reason why I came into Kenya to to talk about it, to invite all the viewers to because we raise awareness through all these topics I said: hypertension, diabetes, promoting health lifestyle, child marriage, educating girls through this TV show, but fashion and art with purpose.
Fantastic. Asante sana, Senator,
Thank
for
you.
joining us.
Thank you.
And all the best.